Okay, we gotta go quick here. We got 10 minutes by YouTube standards. Life in the hospital. Caregiver. Supposedly you have a caregiver by now. You have someone who can come and help you in the hospital. This is going to help you out tremendously. It's just going to be one of the biggest things that I can recommend you get for your hospital stay. You're going to be moved to the ward. You're going to have a monitor wire stuck all over you. You're going to have chest drains, and you're probably going to have a Foley catheter. First day they're going to take out these drains. First day, maybe even in ICU, they're going to take out the Foley catheter, and you're going to be feeling a lot better when they take those things out. Do not get up out of bed. Do not go to the bathroom. Do not take a shower until you are told to do so. If you violate this, they will tie you to the bed, and life will be a little bit more unpleasant for you. Generally the nurses give you pretty good orders, so just do what the nurse tells you to do. Your pillow, they bring you a pillow. Usually it's a gift, and I don't know who provides it, but usually it's a round gift. But the main thing they do is, sometimes they do it, sometimes they don't give you instructions. You just squeeze that sucker as hard as you can when you're going to cough or when you're going to sneeze, and that's what alleviates the pain. The secret is just squeeze it hard. That's the way that it works. Sometimes they don't give you that. The respiratory therapists come in. They're really nice people, because these people deal with people all day long that are in all stages of illness and dying. And they're very, very sensitive, good people. They want you to blow into a device that will get your breathing back up to normal. And what this does is it helps you to inhale deep breaths, and it helps you to blow them out. And when you do that, you help clear your lungs of fluid and keep your lungs clear of fluid that would otherwise build up and affect your breathing or turn into pneumonia. So these things are things that can save your life. So do the exercises that they tell you to do. You're going to have a couple of medical oxygen outlets up your nose. At times they smell funny and they get to be a little dry. You need to take them off and just take a break from them, but keep that on there. It helps the oxygen go down through your tissues. It helps you to heal. It provides more oxygen than you need, and it's just very good. You have the phlebotomist coming in and taking blood tests. If you're on any kind of blood thinner or therapy or whatever, usually they'll take them 2-3 times a day anyway. But if you're on heparin, warfarin, or fragment blood thinners, then they may take them as often as 4 hours. You know, just suck it up and just suck it up. Your nurses are the most important people you have there. These are the people that can help you. They can get things done. They can make life easier, miserable for you. They can get you ice, they can get you water, they can get you apple juice, they can get you yogurt, they can get you ice cream, they can get you whatever you want, unless you really make them mad, and then they won't get you anything. So be nice to your nurses. I had Mr. Gary Wright, former NFL Kansas City Chiefs, I believe, player, and he hurt his knee, so he went on to nursing, and he travels around now, spending months at a time for here and there. Fibrillation is a problem that's occurred in 25% of post-CABG operation patients. It's a condition where your heart just flutters. It feels like a butterfly going in there, and you can run up to 200 beats a minute. It's dangerous unless it's taken care of, and they will read this on your telemetry. All these little wires you got, they'll read that. They'll come in, and they will give you some medicine that will shorten this down. Mine lasted for 8 hours. Your leg's going to be a mess. You're either going to be cut from ankle to crotch, or if they take it out endoscopically, they put a tube in there and they pull them out inside out, and you have 2 or 3 small incisions. But either way, your leg's going to be sore, because that's where they get the veins from to put into your heart. Your pain management is something that you control. You tell them when you're hurting, and you tell them when you start hurting, not when you're hurting. You tell them when you start, because by the time they get the medicine to you, that's when you need it, not 20 minutes later when you really, really, really are hurting. I went from morphine to Tylenol in 3 days because I didn't like the hallucinations that morphine gave me. It all depends on you as to how much pain you can stand, what your pain threshold is, and how much you want. You know, your pain management at home is something between you and your doctor as to how much pain you're having. You're going to have some residual pain. I had pain from a broken back and other things like that. Doctors doctors will come and go, and they're there when they're there, and and you know, they're gone when they're gone. You can't depend on them. They're going to come in, and they might be supposed to be there at 9 o'clock, and they're not there till 5 o'clock. So don't worry about the doctors. They're going to come in, they're going to take care of you, and they're going to tell you what you need to know. All the rest of them, the grunts and the people that clean the bathrooms and all that, just be nice to everybody, and it'll get you a lot farther. If you do have a complaint, go to the charge nurse or the ward nurse. Those are the two people that you want to complain to, because those are the people that can get stuff done the fastest. If you really have a complaint and it's serious, go to the hospital administrator, or call the hospital administrator, and they will come and they will take a report and they will get something done. It's an uncomfortable, traumatic, stressful experience, and sometimes it's just an uncomfortable situation. So complaining doesn't do any good. There's not anything that can be done. But if there's something that's really wrong with the way you're being taken care of, and you think that it's really wrong, then complain to the charge nurse, the ward nurse, or the hospital administrator. Again, we've had to be fast here because YouTube limits the length of these sessions. So your hospital time is going to pass quickly, it's going to fade into memory, and soon you're going to be home.